How are you guys doing?
Hey, Kimmy, how are you?
Good.
Okay. All right.
Ooh, I got a new book.
Oops. Sorry. Okay. Let me. Okay. Good evening and
Buenas
welcome.
tardes, bienvenidos.
Oh, sorry, I'm getting feedback.
Mm.
There we go. Welcome to the 34th meeting of the Community Advisory Group. Wanted to share that we have interpretation in Spanish and ASL and captioning, and I will ask someone to say that in Spanish, please, and then I will turn on the interpretation.
Oh, okay. Bienvenidos, buenas tardes. Queremos dejarles saber las personas que si desean escuchar esta presentación en español, por favor aprieten el icono de la interpretación, el globito en la parte de abajo de su pantalla. Muchísimas gracias.
All right. Thank you. Final, let's see, oops. Instructions on how to select a globe for your language if you're participating especially in English or Spanish. Also, we have closed captioning, which is enabled. And finally, please mute your microphone when you're not speaking and try to speak slowly for our interpreters. And I will turn it over to our public health director and one of our co-chairs, Kimmy Watkins-Tart.
Good evening, everyone, and welcome to our, I don't know what number we're on. I think Lauren probably already said it.
34.
All right, welcome to the 34th meeting of this group. I want to welcome you on behalf of myself and the other two co-chairs, Greg Hodge and Nestor Castillo. We are hoping this evening to continue our conversation about the impacts of the unwinding of the COVID public health measures, as well as sharing any information that we have about, of course, the situation with COVID, as well as what is happening in the areas of Medi-Cal redetermination and really housing. And the moratorium. And there will be plenty of time for us to have discussion and ask questions. But before we start with our agenda, if you haven't already done so, please include your organization name. If you could change your name on your Zoom box and add your organization name to your name so that people know what organization you're with, that would be great. I think that is, yes, that is it. All right. So we want to first start off inviting our community partners from Housing and Community Development to get started with an update on where we are with the end of the eviction moratorium. Jennifer Pierce is here. Hi, Jennifer. Thank you so much for coming to share with us where things are and to answer questions. I'll turn it over to Jennifer.
Thank you so much. I appreciate you having me here. I am going to, oops, hey, Lauren, the participant screen sharing is disabled. Is there any way I can do that? You also have my presentation, so.
Just tried to change the settings. Can you let me know if you see a different?
Oh yeah, that worked. Thank you. Okay, I am going to share my screen and give me 1 minute to get set up. Okay, how does this look, Lauren? Am I good to go? Okay, awesome. Thank you. All right, Good evening, everybody. My name is Jennifer Pierce. I'm the Deputy Housing Director here in Alameda County, and we wanted to give you a brief update on the impending end of the Alameda County eviction moratorium. So I want to start off with this sort of disturbing quote from the eviction lab at Princeton University. Everyone knows evictions are a big deal, but sometimes people just don't know how big of a deal they are. Evictions cause homelessness to rise. They cause loss of child custody, job loss. It can impact people for up to 7 years. There's massive implications, and it is skewed against Black and Hispanic female renters as well, who are sued for eviction at double the rate of white renters in San Francisco. So evictions are a big deal, and we are very concerned that there is an upcoming eviction cliff as a result of the end of the moratorium. So the eviction moratorium ends on April 29th. I'm told by our attorneys it ends at 11:59 p.m. Rent is due on May 1st, and if not paid, a landlord may serve a tenant with a 3-day notice to pay or quit. It's important here to note that any outstanding rent that was owed during the moratorium is not a cause for an eviction notice, and tenants may not be evicted for this lost rent. The key is that the tenant must respond, and I'll talk about that in a few minutes. Our moratorium strongly encourages tenants and landlords to negotiate a settlement, and we have resources to help them do so, but it doesn't require it. So landlords can evict tenants for any lease violation that occurred during the eviction moratorium other than non-payment of rent, as I mentioned. This includes not granting access to the property for the landlord when requested, moving a new tenant in without permission, destruction of property, property modifications, harassing or violent behavior toward a landlord or other tenants. And landlords can start to file this notice on May 1st, and they can file it for anything that occurred at any time during the moratorium. I am not going to go over this. This is just to show that the eviction process is really complex in California. It's probably complex everywhere, but we know for sure that it's complex here. This is the critical part that I wanted to note that we'll talk about later. When a landlord serves a complaint for an unlawful detainer, which is essentially what happens after they serve an eviction notice, a tenant has 5 days to respond. If they don't respond within 5 days, they lose all their rights. And this is where we're trying to catch people. We're trying to catch them after they get their 3-day notice, and then we're trying to catch them after the landlord files a summons or a complaint. A study out of Contra Costa County indicated that 86% of landlords have legal representation, while only approximately 11% of tenants do. And this study indicated that having legal representation really helps in having equitable outcomes from eviction court. And this is why. Tenants lose if they don't file a response, and they lose even if they don't know that they're supposed to respond, even if they are protected by the eviction moratorium, they lose. If they haven't violated their lease, they lose. If the increase is unlawful, even if there's egregious habitability issues, they can get sued for eviction and lose if they do not file an answer. So an unlawful detainer affects a tenant not just now, but in the future. I mentioned in the first slide that credit reports might list an unlawful detainer for 7 years. Future landlords can check this. Landlord databases exist where landlords red flag tenants, and a landlord can attach future wages until any back rent is re-owed as well. So a few years ago, the Board of Supervisors approved some funding for Centro Legal and several other legal aid agencies to develop AC Housing Secure. This is the homepage of AC Housing Secure. You might recognize the name because they have also been the administrator of the Emergency Rental Assistance Program, or ERAP, that we have been rolling out with federal and state money for the past few years. This website is translatable, as you can see in the upper left, and there are resources for tenants and property owners that you can see on the home page. AC Housing Secure also goes into all of the information, well, much of the information that can help tenants as well as community-based organizations learn about evictions, rent increases, small claims court, all of these really complex systems and processes. We have information on this website, as well as information on the moratorium. There are webinars, as you can see, that talk about knowing your rights. Central Legal not only has a calendar on this AC Housing Secure website that talks about live sort of train the trainer presentations, but they also have taped ones in various languages. So community-based organizations that help residents can watch it and learn, as well as residents. So here again is the website, and it details, it has resources, phone numbers, helplines. The way we've set up AC Housing Secure is that there's no wrong door. So there's several legal aid agencies that people can call or email. And if the agency they call isn't the right one, you don't have to make a bunch of calls. The agency, they have a peer-to-peer network in the background. So the agency takes the information, puts it in the system, and then that resident will get connected with the correct legal aid agency. So legal services are critical, and I know some of you are probably thinking that they just serve to, represent people in court, but they actually do a lot of other things. They can help to negotiate before the court case. They draw up settlement plans. A lot of times they can negotiate safe exits, retain the tenant's housing subsidy, and have the case sealed, which again will help the tenant secure housing because there won't be an eviction on a public record. We note that in some of our AC Housing Secure funding pots, we have something called flexible funding, and that allows tenants to do this kind of negotiation of the rent right before the court case, sometimes in the hallway. And landlords might sometimes, because getting a new tenant is such a hassle, if they owe rent, they might be able to negotiate a lesser amount and keep the tenant housed. So these types of opportunities to work with an attorney will help displaced tenants transition to new housing and avoid homelessness, which is really the key. I just thought, we found this chart. We thought it was interesting that 11% of Californians are currently behind in rent. We're doing better than the national average of 15%. But it's not known quite what it's like in Alameda County right now. So although we're talking about an eviction cliff, and we're pretty sure it's coming, we'll see what happens in May. So, just a couple more notes. In the latest point in time count, 41% of first-time respondents said they lost housing where they were on a lease. So, and more than 4,000 people entered homelessness in fiscal year 21-22. So evictions are a major factor in homelessness. And that is my presentation. I'm going to X out of the screen, and I'm happy to answer any questions.
All right. Lauren, how much time have we allocated for questions in this segment?
Let me get that.
Oh, I think we have plenty of time here.
We do. We've got at least, 15 minutes in asking for, also asking people if they have other announcements. So got at least till 6.
All right. Looks like we have Gary. Go right ahead.
Hey, good afternoon, everyone. Yeah, Jennifer, I'm so very much concerned about families with children and the impact that will have on having unhoused children out in the elements. I know you had mentioned earlier or your slides did mention the impacts with regards to school-age children and the dynamics of mental health and things of that nature. But with regards to rental secureness or security, how is that being handled with families with children? Is there another process that they go through, and or are they treated the same?
You know, families with children do utilize our AC Housing Secure network of legal aid providers. Families are one of the key components that we do strive to assist. So if a family with children is at risk of eviction or has received an eviction notice, they can absolutely call, and Central Legal, Bay Area Legal Aid, a number of other agencies can assist them.
And so do we have networks in place with regards to outreach to provide the notification to individuals, such as we're doing with the redetermination and the ambassadors? I know that there are, leaflets and flyers being handed out that specifically give instructions to individuals on how to handle the redetermination process, but have these efforts been made with regards to rental and tenant legal matters?
We do have one-page flyers in a couple of languages, and maybe I could send them to Lauren and she could distribute it to this group. We would certainly appreciate the help getting the word out this month.
Yeah, that would be excellent. Thanks.
Absolutely.
Thank you.
Thank you, Gary. Greg.
Hi, everybody. Good evening. The question I have is around the budget process with the county, and this is a question either Kimmy or Jennifer, somebody who may know. And I don't know if the county process is completed because I have not been watching this process. But was there any conversation at all about rental supports for people who were affected by the ending of the eviction moratorium at the county board of supervisors level?
I can jump in here and certainly
Sure.
say that last month the board asked us, HCD, to come back with a comprehensive analysis of what we thought was needed to help people who we thought were behind in rent and were not able to access the emergency rental assistance program because there simply wasn't enough funding. So we brought a series of proposals. The board has asked us to develop a couple of them. We're going back to the board at the end of this month with our proposals with regard to the pots of money we currently have at our disposal, which candidly isn't enough. We have been able to identify about $5 million in second tranche ARPA funding to help residents, specifically in the unincorporated county, get their additional back rent paid. And we are having conversations about what is needed in a broader sense should the funding be able to be found. We were able to push out about $130 million in ERAP over the course of the eviction moratorium, but it didn't cover rents that were not paid after March 31st, 2022. So that's a big concern of ours because that was a state requirement. If we wanted to use the state money, which of course we did, they said it couldn't be used for rents that were owed April 1st, 2022 and beyond. So yes, it is something that we're concerned about and we continue to try to identify funding for.
Okay, one quick follow-up. I noticed you said the unincorporated areas of the county were included. What was the logic behind that?
The money that we were able to quickly identify and utilize was money that the board had set aside for the unincorporated county out of the second tranche of ARPA funds. So in a past meeting, the board had allocated $15 million to the unincorporated county specifically out of the ARPA funding. And so of that, we've carved out some money for the rental assistance. We're also looking at utilizing money for the other concern that we have are landlords that are facing foreclosure because they didn't have their rent paid. And so we not only want to help tenants, we also want to help landlords keep this rental housing available. So we have identified a couple of pots of money that can be utilized countywide. And we're in the middle of developing that program as well that we hope will help landlords and tenants keep their housing.
Cool. Thank you.
Thank you.
Other questions? I don't think I.
I have a question, as I just said to put my hand up. Do we know how impacted like Centro Legal is, for example, right now? Like a lot of the legal services that are supporting people are, I know they were already impacted probably before this, but do we have any idea of how people's ability to get services?
Yeah, they are pretty impacted. I'm not hearing anything anecdotally about people not being able to get through. We've tried to make it as easy as possible for people to engage with attorneys. But I'm also hearing that there just aren't enough attorneys out there to even hire for this purpose. So we're certainly trying to utilize every legal aid agency that we possibly can. And we haven't heard of a backlog yet. And I certainly heard about it when people weren't able to get rental assistance. So I know people know how to get a hold of me. So I'm hopeful that so far people have been able to get the assistance that they need, but we're definitely going to keep a close eye on that.
So Jennifer, initially, wasn't there rental assistance when the moratorium was about to go into effect, and people were stuck in a portal? And so if you say that you have additional funds, say the $5 million that you referenced for the unincorporated, would those funds go directly to individuals who were in the portal first, or is it on a first come, first served basis?
So we have a tendency not to do things on a first come, first served basis. We found that disadvantages many community members who are already at a disadvantage with regard to the moratorium and rental arrears. I will say that we haven't fully fleshed out the program yet. We're in the middle of doing that, but we're hopeful that we will be able to quickly get the money out to the people who need it the most. And our intent is to provide detailed policies and program guidelines to the Board of Supervisors at the end of this month, so that we can come back by mid-May with contract amendments and get the money out as quickly as possible.
Okay, so for clarification, and what you're saying is that there were no people previously that were remaining in the portal that did not get rental assistance?
There definitely are, for sure. Yeah, there's a wait list. There wasn't enough funding, and the guidelines for the state and the federal ERAP only allowed up to a certain number of months of rental assistance, and people needed more money than that. And in addition, there's people that are in the portal that applied and they owed rent after March 31st, 2022, which we couldn't pay at all. So we know that there's a backlog. We're about to advise people that they're on a waiting list, so they know that we're working on it. And the question is simply how much funding we can harness quickly in order to get it to people who need it.
Thank you for the clarification.
All right. Doesn't look like there are other questions. Thank you so much, Jennifer.
Thank you for having me.
There may be a couple of other questions, and if you have to jump off, we can forward questions to you. But we're going to open the floor to other announcements from advisory group members or other members who are in attendance tonight that you would like to share with the group. All right, very quiet group tonight. All right. Dr. Ablada, I was hoping you were going to say something. You came on camera, but
you can say something if you want.
No, I don't want to force you.
Well, that was, that it's just very sobering, hearing what we all know is kind of coming. And it's just kind of a weird moment. It feels like things could really get worse before they get better on a number of fronts. And this is one of them. And then you alluded to the benefits, which started already the first of this month, the redetermination. So that's of concern. Escalating violence in our communities is of concern. It's been really regular, the gun violence in East Oakland. of late. So that's been weighing heavily. And, you know, the pandemic itself is not over either. So we still have a lot of work to do there. So I think it's kind of an odd moment, and we're definitely concerned about some of the removal of masks in healthcare, although I'm really pleased that Alameda Health System is keeping masks on in the patient care areas. Really pleased about that for some of our communities, just community members in general who need to go seek care, not get infected. And so, but we know that some other systems are removing masks in healthcare, and we've been hearing a lot of those concerns as well. And I know Dr. Moss has also. Grateful that we're keeping them in skilled nursing facilities. I think that that was a big relief to see. So yeah, there's just a lot of pieces to it, and we have, and the emergency hasn't even officially been declared over yet. So the whole commercialization, we don't know exactly what impact that's going to have. So we've been kind of just trying to understand what services will still be available to whom and how and that kind of thing, because I think that will translate into what burden is left for those of us kind of on the ground still in the response, especially for our underinsured and uninsured community members. So it feels like a little bit of like uncertainty at the moment about multiple things, not just about what COVID's going to do next, but about all these other shifting policies, shifting funding, shifting priorities, while nothing has really materially changed on the ground, I would say, in terms of the things we're dealing with, the poverty, and I think the food insecurity we're looking at increasing as well, and now housing insecurity, and kind of what we're worried will be a flood of more of our community members becoming unsheltered, which we already have too much to really deal with. So yeah, so that was why I was quiet.
No, I always appreciate your perspective on things. And so thank you for that.
Okay.
Are there any other announcements? Anyone else want to share or provide an announcement at this time? Okay. We have time, and we'll circle back, toward the end. Really quickly though, I'd like to make an announcement that tomorrow we have our first of 2 listening sessions for our violence prevention procurement. And so we're hoping that many of you, if not all of you, will be there. This is an opportunity to share information with us around how we should prioritize funding, what are the key needs. There will be very focused questions. It will not necessarily be a town hall, so there won't be back and forth conversation. We will be in listen mode and taking notes, and we will take your input and incorporate it into the shaping of the procurement. That is going to be happening. And Lauren, before the night is over, if we can get the flyer and put it in the chat for everyone, that would be great. It's at 10 o'clock tomorrow morning from 10 to 11:30. And the second one will be on April 19th, and we will make sure to get this out. This is not a bidders conference, so this is not something that you have to attend. If you want to apply for funds, this is purely for you all to give us input into how we should be thinking about the work that will be funded through the procurement. The other announcement I have is that there's going to be a screening. So this is Black Infant Maternal and Child Health Week, and there's going to be a screening of Aftershock at the Grand Lake Theater tomorrow at 2 p.m. I'm not sure if there are still tickets available, but it's something that the Public Health Department is co-sponsoring with the California Black Health Network, with Alameda Health System, and many others, to continue to shine a light on the importance of improved quality of care and health outcomes for Black women, for Black parenting and pregnant people. So if you're able, We can also drop that into the chat as well, a link for that. Like I said, I don't know if tickets are still available, but if they are, we'll put it in there. And please come out and support if you can. Okay, the next item on our agenda is the county updates, and I'm going to turn this over to kick it off, Dr. Moss.
Thanks, Director Watkins-Tart. Good evening, everyone. Just before I jump into my update, many of you have probably seen me give a version of this, countless times at this point. I just wanted to hold space for what Dr. Avalado was saying about, really all the challenges are still there on the ground, and I think in many ways we put a lot of band-aids and bandages on during COVID, and many of those have been taken off or ripped off in some cases, and that's still happening. But a lot of the the fundamental drivers of the health outcomes we saw with COVID and we see across the board are still there. And so I sort of paraphrasing or building off what you said, Dr. Avalado, but I think it's important to acknowledge and reflect that here as well. So with that, numbers and slides. We have 68 people in the hospital, 10 in the ICU. Of the overall hospitalization, again, we think about half of these people have COVID-related illness, and the other half are testing positive on screening, but are in the hospital for other reasons. The wastewater signals are low, not as low as we've seen in the past. And the ones that I look at routinely have all ticked up a bit. We'll show those. So I do think there's some virus circulating still, even as it's overall a bit better than we were for much of the winter, although we did have an earlier low period in January as well. Daily reported COVID cases, we're focusing on this indicator less, but I'm going to continue to share it for the time being because it only reflects laboratory reported testing. The trends there are continuing to be downward, and we are back to pretty low levels of case reports. But again, COVID certainly still around, and people are probably still hearing about it in their extended network. 171 deaths since November 1st. We remain in CDC's low community level. Next slide. So this is the East Bay Municipal Utilities District wastewater sampling data. And you can see pretty low, not as low as we were last spring, but getting down there. But if you look at just the last couple of samples, which are from last week, you can see up a bit from our recent low point. Next slide. And if you look at the Verily wastewater testing for Oakland, you can see, and it's the overlapping sewer shed, but it's a slightly different laboratory technique done in a different lab. You can see there is a kind of a similar pattern, a low, not as low on Verily as we saw in the fall, but a low and then a starting to maybe move in the opposite direction. And then likewise on the right-hand side, the BioBot data, which we believe is San Leandro sewer shed data, up a little bit from the low point. So I think very hard, you look at these, they do bounce around, very hard to know if we're just sort of, this is just things moving around, or if we're going to start to see the sort of increase that sort of previews our summer increases. It's very hard to know. But April last year, we did start to see increases gradually, followed by more pronounced increases in May, and that really kept on right until July, with two different of the Omicron subvariants coming in and driving separate sort of humps of last summer's wave. Next slide, please. Hospitalizations really finally getting a little bit below where they were for much of 2023 so far, but still seeing people in the hospital. Next slide, please. And zooming out and looking at daily total number of people in the hospital daily for the whole pandemic, you can see the winter wave that we've just gone through, sort of double wave on the far right. And we never really, we haven't yet gotten back to our sort of pre-wave lows of hospitalizations. And it's possible this is what things will look like for some time, or maybe we'll see a continued drop. It's really hard to know for sure, but we haven't really got down to sort of very low levels of people in the hospital for quite some time. One caveat, though, is over time, the proportion of people in the hospital for COVID disease versus for other things has decreased. So earlier in the pandemic, most of these COVID hospitalizations were people who were hospitalized for COVID disease, at least based on the discharge diagnoses, and that has decreased over time. Maybe that is partly due to how those discharge diagnoses are recorded, but I think some of this, there is some improvement that's masked here, and the other place that I look at is the intensive care units, which are intensive care unit hospitalizations, which are in yellow on the same graph, and you can see really in 2020, after the initial Omicron wave, which is that last very big spike, when you're moving from left to right. We haven't had a huge number of people in the intensive care unit. Some and more during the peaks, but nothing like what we were seeing earlier on. Next slide. Test positivity has been trending down. I think, interpreting this a little bit with a grain of salt, given the fact that laboratory reported testing is much less than it used to be, and this is probably less sort of representative of what's going on amongst asymptomatic people than might have been true earlier in the pandemic. Next slide. The case rate I mentioned, trending down. Next slide. So this is, it's possible I shared this at a prior CAG presentation. Apologies, I didn't look at my slides from last time, but these are death rates per 100,000 residents for people older than 50, going back a year. And we're looking at rates here so we can compare the impacts for different age groups. People ages 51 to 60 in blue, people ages 61 to 70 in orange, 71 to 80 in gray, and 81 and over in the yellow. So what you can see here is really the much higher mortality rates for people over 80. And then certainly high, especially earlier in this time frame for people in their 70s, and some deaths, particularly during the periods of the waves, and people in their 50s and 60s. During the most recent winter months, we've seen very, very few deaths in people under age 50. And certainly this has been the story of COVID all along, but I think it's even more pronounced now. And I'm just sharing this as some context going into our policy discussion. Next slide. But before we get to that, variants, so it's XBB 1.5 across the country in this sort of darker purplish blue, with XBB 1.9.1 in this sort of brighter kind of royal blue that's starting to make an appearance in some places. Just a reminder that we probably are going to continue to see new variants emerge, and one of these XBB subvariants may come to supplant the current variant. And in the past, when we've seen dominant new variants appear, that has coincided with new waves, although many variants have come and gone without triggering a wave, and waning immunity on its own may also be contributing to the waves. Next slide. These are COVID community levels across the country right now. This is about as calm as it's been. And remember, this reflects case rates, which as we discussed, are less reliable, but also hospital admissions. And, hospital admissions are at a low point really across the country right now. And I think we should just be thankful for these periods of calm. It's been a tough 3 years in hospitals and really for everyone. Next slide. Okay, so here's the policy update. So the state changes that we forecast last CAG meeting and in some of our other forums did come to pass on April 3rd. The state ended mask requirements in high-risk settings. Those transitioned to recommendations tied to COVID community levels. The remaining state vaccine requirements were lifted on April 3rd. The state made a change last month in their guidance for isolation. You no longer need a negative test to end isolation after 5 days. You still need a mask until 10 days are up, and you need to be feeling better. And then the Cal OSHA still has some more stringent rules for workplaces when there's an employee exposure. And having to do with testing, notification, masking, those kinds of things. Next slide. So in Alameda County, we did, as Dr. Abalada noted, we did go a different way from the state in one area, that's in the skilled nursing facilities, where we are continuing to require masking for staff in resident care areas. Visitors are recommended to mask, not required. And the reason we really focused on this setting was just the sheer impact of mortality in SNFs in Alameda County. We have about 5,400 skilled nursing facility beds across, I think it's 66 facilities. Almost a third of the deaths in Alameda County were in those, were associated with transmission in those facilities, even though it's less than 0.5% of the county population represented in those facilities. So, really a staggering impact. And we wanted to be more cautious as these other requirements and resources devoted to COVID are sunsetting. And several neighboring jurisdictions have similar requirements in place. But we are going to assess this policy monthly. I think this is really a sort of a bridging policy, maintaining this requirement while we assess the impacts of some of these other changes and the readiness of these facilities to manage in an era where there just is less of everything going around in terms of COVID response. And we're going to continue to align with state mask policy for all other settings. And as sort of broad public health policy, this is consistent with what we've done, moving our strictest requirements for recommendations as the population immunity and clinical outcomes have improved. I think this was a difficult decision that I think many of you know, or at least some of you were part of some of those discussions. We weighed very carefully, and this is where we landed. And I think, next slide, please. I just wanted to briefly comment. You may have heard that Congress voted to end the U.S. national emergency earlier than May 11th, which was what was forecast by the administration. The president went ahead and signed this legislation. I actually think, so the federal public health emergency was not affected by this, is my understanding, where most of the regulatory waivers that were impacting health insurance, things like that were tied to. So the press reporting has been a little confusing, but I actually think this shouldn't have a meaningful impact on people's lives. It's the timelines and disruptions that we were already planning for are not really going to change, I don't think. But just wanted to note that in case people were wondering. Next slide. And really, the things that we can all do to keep ourselves and each other safe have not changed, and are going to continue to be useful going forward. I think that's my last slide.
Do you want me to?
I saw some questions in the chat. Kimmy, do you want me to?
Okay, yeah. Greg, did you want me to do this part, or do you want to go ahead and do it? Okay. Let's see.
Well, I can do it. I don't mind recognizing hands for a moment. So
And I can
any
pull questions out of the chat.
any questions for Dr. Moss or comments? Go ahead, Gary.
Thank you, Bob. How are you, Dr. Moss? As the questions that I put in the chat, further questions. What percentage of the COVID deaths, right, are ethnically divided? Because African Americans have always been at the lower realm of the deaths, the mortality, and then when we look at also the messaging that we're continuously putting out with regards to the lessening of the requirements to recommendations, when and or if say XBB.1.5 is a low contagious level, and what if a new variant comes along and we have to implement or re-implement these new the policies? We've already spoken to the public with regards to no masking, no other requirements, and how do we re-implement those policies and regain the public trust? So I think that there should be some messaging that indicates that we still have confidence in masking, we still have confidence in testing, et cetera, and continued vaccination. But we're just totally throwing the baby out with the bathwater from my perspective. So if you could talk about the percentage of COVID deaths and a percentage, and then also the messaging aspect.
Sure. So percentage of COVID deaths. So and this information is on our dashboard. I don't think we have it as a percentage, but you can look at the totals, and about 400 deaths reported amongst African American county residents, which is I think that's out of about 2,400 deaths. So as a percentage, it's I can't do that off my head, but a little bit under 20%. But as a rate, account for the fact that the population of the different racial and ethnic groups differ in the county. The rates of death amongst Black residents are still the highest of any of the large groups. And we know there are smaller communities reflected in these large categories that have vastly different outcomes from each other, and that this is really an area, and Kimmy and I were just talking about this a few days ago, where the department and others really want to do a better job in terms of how we can look at our data better to pull out those different stories and experiences of different communities. These categories are not adequate, but in this case, I think that the story that they're telling is true, that the impacts for Black residents in Alameda County were especially severe, and other communities of color, historically marginalized communities of color, Pacific Islanders, Native Americans also have very high rates. They're smaller populations, so the the numbers one death can make a bigger difference in some of those groups, but certainly we saw similar mortality rates in those other communities. And then in terms of years of life lost, which reflect the age at which people are dying, we also saw really substantial impacts amongst Latino residents. So it's, everybody was impacted, but certainly communities of color and certain communities of color much more so. And then the more challenging question is, how do we manage the messaging? I think we have tried to continue to emphasize the importance and utility of masking in Alameda County, and to continue to support mass distribution and masks as a tool people can use to keep themselves safe, and also to continue to draw attention to the risks and concerns with COVID, and to avoid the trap of sort of brushing it under the rug, forgetting about it, normalizing it in any way, both in terms of our approaches to policy and how we communicate. At the same time, certainly, we're not on the same platforms that we were earlier in the pandemic. We know in some communities this is not as big of an issue as it had been earlier, and I think we need to allow some space for people to be paying attention to other things. I truly hope we are not in a place where we have to look at going back to some of these tools. I think our ability to use some of the sort of local health restrictions, or even statewide health restrictions, is under threat nationally, and has been removed in some places, many states. And I think that's, maybe that won't be the case here in California, but it might be. And I think we need to be very thoughtful and judicious about how we use legal requirements going forward. And that's not to say that a case might not be made for broader requirements at some point, but we are going to be very thoughtful about when and how we would do something like that. But there's a lot of other things that are really useful for COVID, and that have proven to be useful over time, that we can do, including, of course, getting as many people vaccinated and up to date on their boosters as possible, making sure people continue to have access to the effective treatments that we have, and getting people in masks, even if it's not with a requirement. So I think, we need to be prepared to do that to some degree now, and think about how we might dial that up in the unwished for situation of a bad variant, or a different respiratory viral pandemic that was, this bad or worse.
Cool. Dr. Noha.
Thank you. Yeah, thanks for that, Dr. Moss. I guess I'm just curious what you're thinking when I'm looking at how we're doing right now, just on all the objective things that we measure that seem like reasonably reliable, like deaths and hospitalizations. And this time last year, we were much lower than we are now in terms of hospitalizations and even deaths. I think the lowest weekly deaths we've had for the entire pandemic for the country was last April, so April 2022. And then just looking at California and even Alameda County, like I was just looking at April 2022, we had like 40 people in the hospital and 3 in the ICU. Right now we have 68 and 11, and we're feeling like, oh, it's good. But I guess just with that perspective, just curious so I know you don't have a crystal ball, but like, do you think, like, this seems to be our good time of year for whatever reason, the past few years, this April time. But like you mentioned, waning immunity with the boosters, as well as, I always say waning enthusiasm for boosters on top of that. And just like, what do you feel like we should be sort of preparing for, or do you have a sense, or is the modeling going out further now than it was, to where you feel like you have a sense of what the summer could look like? Or is it still like you're not willing to talk about more than 2 weeks kind of 2 weeks out.
Even 2 weeks, I'm a little shaky.
Yeah. I mean, and how helpful do you think wastewater is going to be to help us with to answer any of these questions? I know even in the short term, because I still haven't seen it. I just am not sure how that's going to guide us. But I just kind of wonder just your overall sense about that. How worried are you about the summer, about next winter, and so on?
So let's see, a few things in there. First of all, and I'm sorry if I gave the impression that I thought things were good. Better, yes. Good, I'm not sure that I would say that. And I think, we are seeing a continued sort of, grinding impact of COVID, primarily in people who appear to be at greatest risk, primarily due to age, at least based on, the mortality information. That is not the only thing that we need to look at, but it is the one that's most straightforward for us to look at here at the local level. And I don't know that that's going to change radically. I think we're going to continue to have a lot of people at risk, and people are probably, losing some of their protection over time, and COVID is not going away. So, but whether we're going to see major spikes or ways that, that strain the healthcare system, I feel more confident that that's less likely for the sort of general population, that we're going to see massive waves that result in large numbers of severe illness, and more likely that we're going to continue to see this kind of grinding picture with smaller peaks and valleys. But that COVID has proven its ability to change. We've been fortunate that it hasn't changed in a way that has resulted in an increase in severity, a substantial increase in severity, more in sort of transmissibility and of immune evasion. So I think it's going to be around, and let's hope that it doesn't do something that results in increased severity for whatever reason. But that is, I wouldn't rule that out. Yeah. So and I think that waning immunity, but also people over time, people's certainly protections falling away, and people's behavior continuing to normalize, maybe that's the wrong word to use in this context, but, people who had been more cautious are being less cautious, more people back in the office. All of those things are putting the remaining people who are, at very high risk, who weren't yet exposed, eventually that they are getting exposed. And there are things people can do to protect themselves, but we all know it's hard to keep that up, at 100%. And I think, we have focused on one very important key sort of requirement here, and we are continuing to try to do some of the other things, but I think we are going to continue to see people become susceptible, or people who were susceptible get exposed and see impacts. And I don't know what the endpoint is.
Yeah.
All right. Any other comments, questions? And thank you both for that last bit.
There's some questions about long COVID that I could just quickly address. First is, are we collecting long COVID data, and how does that compare with COVID data overall? From Gary, that's we don't. There's no reporting of long COVID diagnoses, and there are some definitions out there now that health agencies have come up with, and there's a few different ones, although they're starting to be some consensus definitions, but it's not something that is separately reportable to health departments. And we are interested in figuring out how we can get a better sense of this in Alameda County, but because the definitions are both broad and varied in terms of how people have looked at this, we don't really have a tool that, to do that here locally. But I think this is we've been talking about it a lot, but actually it's a story that has yet to be fully told. And then in terms of and Donata is sharing a little bit of information that we're getting, just survey data, and I think that is going to be very useful, but it will not answer the question of, what is the burden of long COVID in Alameda County, and eventually, it would be great to get to that place, but we have quite a ways to go, I think. Even if you just sort of look at estimates of the extent of long COVID, sort of for larger populations, there's a lot of different estimates out there, and different experts have sort of pulled these in different ways. And I think also there's data to suggest that the new long, people were at higher risk of long COVID earlier on in the pandemic, or less so now. Could that change? Is that true? Could that change with the new variant, or could that change as immunity wanes? We just don't even know. So many unanswered questions about how we would get at this, or even what the extent of the impact is.
But Dr. Moss, your concern would be more so if the requirements are changing with regards to redetermination and individuals having the affordability to pay for Paxlovid, et cetera, treatments, access to care, then more individuals who are susceptible to long COVID and diagnosed with such, may not be eligible to receive care and or medication because, the diagnoses aren't defined, and, then the eligibility, they're falling between the ranks, so we're creating.
I think this is it already is an issue, and it's going to be a bigger one. Understanding long COVID, accessing care, making diagnoses, what it means for people, it's going to be very complicated. Very complicated.
Any other comments, questions for Dr. Moss before I turn it back over to Kimmy? Okay, thank you. Kimmy.
So I think, let me just check before I say this, but I do think that we are at the end of our agenda. And so if there are no other comments, any other updates, any other last questions? Nestor?
I know folks might be ready to go, but I just wanted to make the announcement that there's a group that I work with, the Hayward Community Coalition. They're organized a couple of tenant events in partnership with Centro Legal to try to meet folks in the southern part of the county to provide that sort of tenant legal service. And we're also sort of considering doing a tenant fair. So folks in the southern part of the county who are servicing the community there want to participate in that tenant fair, please feel free to reach out. And I encourage others to do sort of similar action. I think it's super important that we kind of show up and especially for folks who are at risk of being displaced and unsheltered. And so if anyone wants to participate in the southern part of the county, feel free to reach out to me. I'll have my email in the chat.
Thank you. Any other announcements? All right. Well, we will give you all back almost 30 minutes of your day. So thank you again for joining, and have a wonderful evening.
Hey, thanks, everybody.
Peace and blessings.